გამარჯობა, მე ვარ ლიკა ჭყონია, ქართულ-ამერიკული რეპროდუქციული კლინიკა რეპროარტის დამფუძნებელი და დირექტორი. ჩვენ ვაგრძელებთ ჩვენი პოდკასტების სერიას საუბრები ვიტრო განაყოფიერებაზე. დღეს მინდა წარმოგიდგინოთ ჩვენი კლინიკის ახალი ექიმი ალიონა ბურმისტროვა, რომელიც არის მეან-გინეკოლოგი და რეპროდუქციული ენდოკრინოლოგი. ალიონა შემოგვიერთდა სულ ცოტა ხნის წინ, ის არის ექიმი უკრაინიდან. სამწუხაროდ მას მოუწია თავისი ქვეყნის დატოვება, მოგეხსენებათ ომის გამო. ისტორიები, რომელსაც ალიონა ყვება, ეს არ ვიცი, ძალიან ძიმეა და ცრემლის გარეშე ამის მოსმენა შეუძლებელია, მაგრამ შევეცდებით დღეს მშვიდად ვისაუბროთ იმ პრობლემებზე და იმ სიხარულზე, რომელიც ჩვენმა ქმედებამ შეიძლება ადამიანებს მიანიჭოს.
Hello everyone, I'm very happy to be here. It is a big honor for me to have such a kind introduction, and I'm really happy for everything, and reproart for meet me so warmly, and we will have a very interesting talk today about IVF treatment, and it is from some point miracle for our patients and for us till now, I think so.
Alona, we had talks about IVF, but from you, I would like to speak about IVF again and what it is, how we start, step by step, for the patients again and again, to repeat for them what they have to experience, what they have to do to have treatment, IVF treatment.
Yeah, first of all, IVF, it's a great opportunity for the patients because many years, many doctors and scientists all over the world were trying their best to make this method works, and it is working now, and we have pretty well opportunities for our patients. They should know about it. Second side of that, we should be sure that this IVF treatment will be safe, the same way as useful, and that's why we are doing plenty examinations and preparation for the cycle. For all our patients, we are doing the same way preparation, and that's why they should get ready for not IVF cycle, but for IVF journey. It is pretty common sense now because it's not single cycle. It is some time to get baby in the end, healthy child, and it is our main goal.
Main goal, of course. Alona, in your words, what are the factors affecting fertility for the patients? What they should know when they have to come to see doctors like you, and what kind of advice we can give them not to spend their time and to come here on time?
Lika, you are very right with time. Time is a crucial thing for us. Think for reproductive specialists all over the world. Many years, women had tried to get independence, and we were trying to be equal all the time. But unfortunately, with timing, it's not so equal as it was before, and that's why patients should be here in reproductive center in 1 year of trying to conceive in the age up to 35, and in 6 months of the same trials in the age after 35. When they have done some chemotherapy or oncological treatments or something like that, before this treatment, they should visit us in advance. Together with their oncologist, we will make a decision how to make preservation of their fertility cells before starting. It is crucial. Time for us is the main thing. Second of all, we are expecting to have for sure patients with some disorders and chronic diseases. As I told, oncological things, oncological diagnosis, the main thing that brought patients to us when they have no other options. Also, patients who had some genetical problems, inheritance disease in their families, and if they have some problem with pregnancy care, so during previous pregnancies they had many miscarriaging, or like they have preterm delivery, or they have problems with not only with conceiving but also with carrying the pregnancy. Also patients who had a diagnosis that is not okay with pregnancy, and we should plan some another type of program to make for them future with child, but without risks for their own health.
So you mean to be to include in the treatment third party, right? Like
Sure.
surrogate or the donor.
Yes, sure. And we are happy that we are able to do that now legally. Nothing special in this treatment nowadays in Georgia as well, the same way as it was in Ukraine. Unfortunately, now there is not so many places in the world when you are able legally to do these programs, and it's really IVF treatment, just different kind of IVF treatment. And people are coming due to necessity with this request, with long journey of infertility and with trials, with attempts. And they can find the solution in Georgia. And I think that it is great.
I think what is main problem in surrogacy and donation, it has to be well regulated. We need to treat surrogates and the donors like our patients. I mean, they are our patients.
They are our patients.
So we need to, think that we are ethical clinic and we approach their treatment as if they were intended parents. And the part which is very well regulated in Georgia, probably that's why patients from all over the world, Georgia attracts them to come here. They have to be safe. They have to feel safe when they have this. Actually, it's a very stressful journey, right, for
Sure.
them. They are far away. They don't know what is going on with the baby. We are sending pictures every time surrogate comes to us. It's very, nice job from our side, but they are stressed.
For sure.
So I think that the part of it, which is very well regulated in Georgia, this makes Georgia attractive. What do you think?
Yeah, I think the same. And we should be honest that not only in Georgia surrogacy is legal,
Yes.
but for example, in United States, they have the same opportunity, just equal, but price of those are twice, sometimes 3 times more. And we have the same opportunities here. And sometimes patients even, they did not know about that country before, but when they are starting searching for this option, they found out about the Georgia, about country by itself. And we should explain that it's the same way safe as in United States. We have the same equipment, we have the same skills, we have great school. We are attending all possible congresses and for embryology.
Presenting also.
Yes, and presenting as well. And we are able to do some researches and we can write articles because we have big experience, especially ReproArt has very big experience in IVF treatment in Georgia, one of the first clinic in Georgia. And that's why we should tell them, and this message, I think, will be helpful to decrease level of stress when patients are trying to find the country for this IVF journey abroad. Sometimes they need donation that is illegal in their home country. Sometimes they need better embryo selection because in many European countries, for example, it's still not allowed to cultivate embryos till blastocyst stage, to make PGTA testing.
Yes.
Yeah, and sometimes they need extra options because of genetical things. And this embryo selection, it's not only by their wish. Their wish is to have baby, healthy child.
Healthy child.
Yeah, and we have these opportunities, but we should be on each of those steps. We should be together and we should be honest with each other.
That's very important.
It's very important. Yeah.
And what you would say to your patients when they approach you? Where are we in terms of success? Because they don't know that Georgia is as successful as United States clinic can be, right?
Yeah.
So we tell them that.
Yeah, we are explaining them that we have statistically equal results. It's very individual, up to patient's age, up to patient's reasons to come, up to patient's oocytes quality. Sometimes we have even better opportunities for oocytes freezing, for example. we are free in it and throwing, and we have equal results as embryologists and reproductologists all over the world. But we have all these options together here, and we're skilled in it, all of us.
Do you think that the programs we have tailored for each kind of treatment for the patient, it helps them to decide what to do? It's individual, right?
Very individual.
It's tailored to their needs.
Yes,
correct?
for sure. And they sometimes could not realize it from the start. And we should explain that. And that's why prior to coming here, we are talking a lot. We are talking, mailing, explaining. We have long way before receiving the patient by itself in the center. And this explanation will be needed. We should explain chances honestly. We should be telling that probably not single stimulation will be used. And we can explain also that you have poor chances, but if you still would like to try, we are able to make it. But we will recommend you another options, what will be much more successful in your case. And this explanation will help patients to choose their way.
And they feel that we are so experienced that we can just give them this same option, what they need for their results.
For sure.
Right?
And I think that this explanation is the most crucial thing when person is not promising you something, miracles to be done.
Right.
We are just telling honestly what can be done.
100% pregnancy rate.
Yeah, 100% pregnancy rate, no one can guarantee.
Right.
And
no
we can tell just honest numbers, and we should explain that, yes, we are able, we have the same opportunities equal, but no more.
Yeah, and it's not only egg, it's from male side as well. We can have problems with the normal appearance sperm that we can have embryos which are not suitable for the pregnancy, right?
Sure.
Because of the male infertility.
Yeah.
And as a new person in ReproArt, what you see here different? Why you feel comfortable here and why you decided to come and work with us?
ReproArt has many advantages. First of it, it's embryo laboratory that was built with the highest level of standards of everything, like with materials, air quality, control of KPI of all processes and describing of each step separately. And it is very useful even when you are working with the patients, when you are providing this information step by step, they can see that and they can be involved in the process and they are trusting you much more. Also, ReproArt has branches in Georgia, and it's more easy for local people to have some tests done, and for foreigners as well. They can choose where to make some examination, in which center. Also, there are a lot of professionals in one place, and we can make everything for our patients here in few days. And that's why for foreigners, it is very attractive to make in 2 days all necessary examinations before starting program. And we can repeat easily tests. We have own laboratory. We have own genetical laboratory that is really individual here and extremely different from other centers because we are not sending our samples nowhere. And we can discuss with those genetics who are doing these tests the result. Yes. And we can talk about it and we can receive an explanation accordingly, and it is really big deal for us, and it will help and us and our patients to understand, because we are not specialists in all fields ever.
Yeah, we cannot be.
We cannot be, yeah, and we are asking in communication, and this direct communication will help not only us but our patients as well.
Yeah, and I would add on that we. It's not recently already. It's been more than 1 year we purchased our eyewitness, which is additional safety for embryologists and the patients. And I will just give brief the explanation for the patient. This is a system which tells us that we are not making mistakes, that the biological material, we are plugging the name in the system. And if we accidentally picked wrong dish where the biological material of other patient is, and we put under the microscope, will give us alarm and will tell us just that we are making mistakes. So usually what we did, and we still do, 2 embryologists are checking if the name is right on the dish and on the system. But now we have additional check from the electronic witness system. So I think this is also some safety and guarantee for high quality treatment and care, right?
Especially in IVF centers, because all of us know that where is human resources, everything can happen. And that's why we should be protected. And now, thanks God, we have this protection and opportunity for that. So I think, yes, you're very right in it as well.
So, what about your patients? We spoke a little bit about the emotions. What do you think? How emotional is that for them? What is your role of comforting them? And I think you are partly psychologist as well, reproductive endocrinologist.
All of us are.
All of you, right, yes.
Our patients are very different. Sometimes they happily are explaining each step. They have plenty documentation, test results from every IVF cycle. They are bringing, sharing, explaining. They know everything. And they are trying to explain you the situation with them. Sometimes they are just closed and they cannot speak about it, about miscarriaging, about year when it was. They are trying not to think about it.
They're forgetting everything.
They are forgetting everything. And they are even telling such words like, I thought that these doors for me had been closed several years ago. And now I recovered a bit and I decided to try last time. And, it is the awfulest words for us. I decided to try.
Such a responsibility. They are putting on you those responsibilities.
Yeah, yes. I decided to try last time. And this last time, making you think so much that you have never did before.
You have to have a success.
Yeah, you should. You must.
You must have success. Yeah, and it's I have huge experience in working in this field, and if not the success we have, we could not overcome the stress of failure, right?
Yeah,
and we have more success than failure. It's such a blessing.
It's a blessing, truly. And, in our field, everywhere, no matter where you are, in just a routine lab or in genetic lab, or in embryo lab, or you are with patients directly communicating, everywhere in IVF, you should think about patients.
Right.
First of all.
Of course.
And reproart, it is about it. We should think from the first step, them here till the end, and we are doing so. And it is the most attractive thing here, I think, and the most comfortable, because we can have mistakes.
Of course.
Like in communication, in timing, in everywhere. But we are thinking about those mistakes and we are improving our...
we are not hiding them.
Absolutely.
We are talking about that. This is very important.
Yeah, to make it better.
Right.
Step by step, we can make everything, but we should be discussing that. And that's why we gathering together, making some conclusion, making some plan for the future. And it is the best way, I think.
And for me, as for the, director of the place, it's very important. And what I see how you doctors and embryologists and the whole staff is communicating and helping each other. It's such a nice thing to see. Every morning when we have a discussion of patients, it's really something, because I have hope that all our young doctors are learning from you guys, what you are telling them, how you are explaining all this journey for the treatment cycles. And I hope that we will have cohort of new, very well-educated doctors following you. So it's really pleasant for us to see it. And I really want to thankful for that. And Yes, our philosophy, what you shared with us, that we have to be very ethical and we have to, first is the patient. And then we are medical center. We are not, I was once told that I'm not right when I said that it's not business for me. It's just what I know. This is only profession I have. And I want to do that as well as it is possible, right? To help. Otherwise, there is no reason to be here, correct?
Sure.
So we have to do our job as best as it is possible. So thank you, Aliona, very much. To be with us and share our philosophy that medicine without science and medicine without technology and care, it's nothing. So we combine this whole, and I hope we will have more and more success.
Yeah, definitely. Thank you so much for making me share that, because really it is crucial, and we are not talking about that so frequently. We are just working. All of us are working not only for salary, but for the results, for the patients. But everyone has different priority. And for us, our priority, it is patients and their comfort, their easy, if it can be easy, way with us. And we are trying our best with the results and with the explanation and with tests and with embryos, with everything. On each step, we are trying our best. And it's the main thing. Because in the end of each IVF treatment, you should reply on one question for yourself. If you made everything what you could in this case, and if you are doing your best and you are sure that you did your best, in that case particular, you're calm, no matter of the result, because sometimes we have failure as well. But we are calm when we doing our best on each step for our patients.
Okay, and I wish to have at the end of every case, every cycle, healthy baby.
Yeah, and we have all options for that.
Okay.
We have all options for that.
დიდი მადლობა, ალიონა. მადლობა ჩვენს მაყურებლებს. გვიყურეთ შემდეგ სერიებში და გამოიწერეთ ჩვენი YouTube არხი. ნახვამდის.